Good afternoon to all of you, and welcome. I want to recognize Institute directors who are sitting here in the first couple of rows. I also want to recognize the Clinical Center's Patient Advisory Group who are here today. Thank you for joining us on this special afternoon. But especially, I want to welcome our guest of honor, Senator Barbara Mikulski. She grew up in East Baltimore, went on to improve her community as a social worker and community activist, her city, serving on the Baltimore City Council, her state, Maryland, and ultimately her country, first from 1976 as a member of Congress, and then from 1986 as senator. Today, as she looks forward to concluding her remarkable career of tremendous public service, she is here to speak to us. And we're proud to say she's not just an amazing senator, she is our senator, the senior senator from Maryland. NIH has been fortunate to have such a fierce champion on our side. And NIH is a better place, I would say, for the fact that we've been challenged to work hard to live up to Senator Mikulski's standards that reflect the stewardship role the country has entrusted to us. In fact, just last week, at the appropriations hearing, the senator codified her expectations of NIH into 3 guiding principles. First, do no harm. That's a good one for us. Second, capitalize existing programs. Third, go for the big ideas. Well, Senator, those are wise exhortations, and we aim to live up to them. So reflecting on how to capture the progress that has occurred in medical research since you entered the Congress and helped us at every step, I thought it'd be interesting to pick 4 areas and quickly consider what we knew in 1976, what we knew in 1986, what we know today, and what we aim to learn in the next decade. Let's start with HIV/AIDS. 1976, it was unknown. By 1986, AIDS was known, feared, spreading rapidly, associated with very poor outcomes. By then, we'd identified the virus, but AIDS was a death sentence. The disease was spreading so rapidly, it was feared there would soon be insufficient hospital beds to house all of the AIDS patients. But then progress occurred. AZT, then HAART, discovering how to stop mother-to-infant transmission, and today we have turned AIDS into a chronic disease with new means of prevention holding the promise of an AIDS-free generation. And looking forward a decade, I'm optimistic an effective vaccine for HIV/AIDS will be available, giving us the opportunity to bring an end to this most frightening and costly global epidemic. Consider cancer. 1976. Mikulski was elected to Congress 5 years after the official start of the war on cancer. But we didn't know very much about cancer at that point, although in 1976, interestingly, that same year, future NIH and NCI Director Harold Varmus, working with Michael Bishop, conducted those experiments revealing that the Src oncogene was not just a viral gene, but was also very similar to normal cellular DNA of many other species, including humans. The oncogene hypothesis was born. So in 1986, by the time the Congresswoman became Senator Mikulski, the genomic basis of cancer was established. That knowledge brought about a host of promising developments, and today we have a far deeper understanding of the molecular basis of cancer, better screening, more precise, tailored treatments. We're learning how to use the immune system in new and exciting ways and preventing cervical cancer with HPV vaccines. And you can see the difference in the numbers. Cancer death rates have been falling steadily by more than 1% per year, by more than 23% during Senator Mikulski's time in the Senate, which we calculate saves 1.7 million lives. That's why I have confidence in our current launch of the Cancer Moonshot with better rocket and better fuel and a clearer view of the target. But we have a lot of work to do because we still know that many cancers do not respond to our best ideas. The work still lies ahead of us, but we have this now on a foundation that's stronger than I would have thought possible even a decade ago. Third example, Alzheimer's disease, a condition that Senator Mikulski has been a tireless advocate for our efforts to make progress. And this has been a tough one, no doubt about it. In 1976, we had a name, but we didn't know much else about Alzheimer's disease. In the mid-1980s, we discovered beta amyloid and tau protein. were in some way depositing in the brain, and the first genetic risk factors were identified. Today, even as the public health burden has grown, we've learned a lot, and we've expanded our knowledge and understanding of brain function, and for the first time, we have a signal that intervening with individuals at high risk prior to the onset of any symptoms may in fact show benefit, but it's an early signal. More than 90 drugs for Alzheimer's disease now in clinical trials, many more in the pipeline. Our efforts have been aided by the Congressional Bipartisan Task Force on Alzheimer's Disease, of which Senator Mikulski is a member, and I think also by our basic science efforts, including the BRAIN Initiative, but we have much to do. I would predict, though, by 2026, 10 years from now, we will be able to offer interventions to individuals at high risk before any symptoms appear, and that those will be successful in delaying or preventing the onset of the disease and stopping personal and family tragedies that are all now too common. Fourth example, heart disease. Another place where Senator Mikulski has played a critical role. In 1976, deaths from coronary heart disease peaked, but they started to decline after that, aided by knowledge generated by the NIH's famous Framingham study and other studies as well, and we were beginning to make progress by 1986 of controlling some of those risk factors that Framingham helped define. Today, we have a host of technologies that help unblock arteries and diagnose heart disease and keep hearts beating strongly. Deaths from cardiovascular disease have dropped more than 70% in the last 60 years. But we still have work to do there, too. Hope is on the horizon, though, for heart failure, which continues to be a major challenge. Early experiments suggest a patient's heart could be even rebuilt using his or her own iPS cells. This personalized rebuilt heart would make transplant waiting lists and anti-rejection drugs obsolete. Now here I have to give a shout out to Senator Mikulski. Her own contributions to improving women's health in general, and particularly focused on heart disease in women, are evident in her support for creating and sustaining the Office of Research on Women's Health. Back in September 1990, maybe she'll say something about this in a bit, she and a group of colleagues came to NIH to address concerns about the exclusion of women from clinical research. That led to the formation of the Office of Research on Women's Health, which celebrated its 25th anniversary just last year, and I'm very happy to recognize Vivian Pinn here with us today, who served as the visionary first director. And also, though she's traveling, Janine Clayton, who ably leads ORWH now today. So ORWH has helped craft all sorts of policies that have expanded the inclusion of women in clinical trials. And Senator, we aim to be very dedicated to make sure we do not slip back in any way in that effort to be sure that our efforts in clinical medicine apply just as vigorously, if not more so, to women as they do to men. And we recognize that was not always the case, and you helped us see that. Well, each one of the Senator's visits to NIH has been memorable, and I've been really honored to have the chance to host her here several times since I've become NIH Director. I remember one particularly well in early 2013. We were working at that point to try to head off the looming sequester. And a clinical center patient, Felicia Sanchez, from a small town in Arizona, had come to NIH after her doctors could really do no more to help her with her severe valley fever. And here, under the treatment of the doctors here, she got better, and she told the senator, all the possibilities. That's what NIH gave me. And that's when the senator, visibly moved, explained with appropriate gestures, I'm going to work my earrings off to ensure the National Institutes of Hope has a mission that continues to move forward. That is also a term that she coined that many of us are very attached to, including this lapel button I have, which labels us as the National Institute of Hope. So in that moment, and in many others, I saw the passion, the conviction, the commitment that has moved Senator Barbara Mikulski to do all she has done for NIH, for patients, and for so many others throughout her long and distinguished career. So now, enough about me. I'd like to invite Senator Mikulski to the stage to say a few words to the assembled folks who work here at NIH. Senator Mikulski.
Science. Wow, thank you so much, Dr. Collins. That was a lot of science in those comments, but then there isn't a time that I come to NIH without learning something new, either from you or from the very distinguished group of people in this audience and throughout the NIH campus, the NIH family. And I see so many of my friends here in the audience, people I've known over the years, the directors of institutes and offices, and my pal on the barricades, Dr. Pinn. And I say that because, you know, we've been in forums and we've been on the barricades together. Well, I wanted to come by NIH today to meet with Dr. Collins and his team to be sure that as we work on our appropriations for NIH for this year, that we have the right resources going in the right direction so you get to do you, so you get to be you. That's been my passion for the time that I have represented you. My single goal was to let you be you so that you could come up with the cures and the breakthroughs, the new ideas, the new science that would help the American people and people all around the world. And coming here today, I wanted to talk a little bit about where I'm going and a little bit where I hope you go as well. And when I say where I'm going, you've of course heard that I'm turning a new page. But I want you to know I'm not writing a final chapter. I'm here ready to roar, ready to roll, and ready to get the job done. Last year I had to make a big decision. Was I going to run for re-election or not? And as I thought about it, I came to those conclusions. I knew that I wanted to serve. Serve is in my DNA. And if you take the sample, you take the swab, you'll find the serve gene. It's right here, and you can't take it away from me. But what I also knew is it takes 2 years in terms of running for election and 6 years to serve. And how did I want to spend those 2 years? Working to keep my job or worrying about your job and the American people? Was I going to spend my time worrying about the next election or worrying about the next generation? What was I going to do? Raise money for me or raise hell for you? That's when I said I wanted to raise hell for you and worry about that next generation and not that next election. So I chose not to run for office again, but I want you to know, though I won't be running from office, I won't be running from service. And one of the areas that has been one of my greatest joys has been to represent NIH here in Bethesda and all the wonderful work you do, and also on the extramural campuses that are in Maryland, whether it is the Johns Hopkins or University of Maryland or Craig Venture or all the other great and fabulous places where you do this fantastic work. And it's also been my great joy to work with great people and great leaders. Dr. Pinn, you and I have been together a long time, and you know what we've been able to do together. Dr. Collins, you know, you do great work. You map the code. You know, he raced for the human genome, and I'll talk about that. We've always had the right resources. But you know, NIH is not only about its great leaders, and it's had so many. It's the fact that everybody at NIH is a great leader. And I have been so proud to represent the 27 institutes and centers, the thousands of people who work here. And I think about you every day, whether it's the researchers, the scientists, the lab technicians, to be able to do what you do. And during our time together, I've seen so many amazing changes. It's what Dr. Collins talked about. When I came, We didn't even know how to spell the word genome, let alone race to be able to map it. And I was so excited to see here in Maryland that there was Craig Ventnor and there was Francis Collins. They were duking it out. They were racing to map the code. They were inventing new science. They were inventing new methods called computational biology. There would be wonderful new fields, but at the end of the day, it's not who won that race. It's that the American people won that race. And you know what's so great about our country? You know, a rich nation could have found a way to map the code, but a great nation like ours gave the information to the world. That's what was so exciting about doing it. And then also seeing breakthroughs in stem cell research, which I know is undergoing. The whole work on cutting cancer by 10%, stroke deaths and stroke disease, 10%. Right now I know that Dr. Fauci, who worked to really break the AIDS code, is now working on Zika. And science after scientific discovery that was done. When I started my career in the Senate, you saw those pictures, and I want you to know certain things don't change. The hair color didn't change. You see the same color jacket in a couple of pictures. It's because the waistline didn't change. No matter what others might say, it didn't change, and so on. But really what we saw was great science. And I do recall, back in the 1980s, when I was in the United States Senate, in those early days, we heard about this mysterious disease that started in San Francisco, was somehow or another heading to the East Coast, that men whose lifestyle we didn't know, and quite frankly, we shouldn't have cared. We needed to care about them. Were beginning to get pretty sick. America panicked. America was in terror. You wouldn't shake hands with somebody you suspected. A little boy named Ryan White was so isolated in his classroom that other children wouldn't talk to him, that he was bullied, and he had to sit in a room all by himself, like in solitary confinement, reading his books while his teachers talked to him through a microphone. That's the fear and terror. But along the way, Dr. Fauci, working in virology, along with other gifted and talented here, was able to come up with new ideas that made sure that HIV/AIDS became a chronic condition and not a death sentence. What an amazing way. And if Ryan were here today, because I have talked to his mother a few years ago, he would be so excited. He would now be in his late 20s. He might even have worked here had we found out sooner. And to see that great progress. And another great area of interest to me was the fact of women in research. Now, I'd been in the House and I'd watched the GAO reports that said women were not included in the clinical trials here. Off I went to the Senate. There were only 2 women there at the time. Now there are 20 of us. And it was Senator Nancy Kassebaum and I. GAO came out with yet one more report, like that famous study, take an aspirin a day, keep a heart attack away, 10,000 male residents, not one woman. Over there at the National Institutes of Aging in Baltimore, they did that longitudinal study on aging. Not one woman was included. Their answer was, we don't have a ladies' room in the bathroom. Dr. Edward Berman at Hopkins said to me, the reason women aren't in protocols is that you girls have raging hormones. I said, Dr. Berman, we have raging hormones because of guys like you. He was a great guy. So we girls know how to deal with our hormones, and we know how to deal with that. And then Senator Olympia Snowe, Pat Schroeder, Connie Morello of Montgomery County, and I wrote a letter to Dr. Robb, said we were coming to NIH to talk about how to get into the protocols. When we pulled up, George Bush the Elder had appointed Bernadine Healy to be the director of NIH. We had our meeting on goals, tasks, and timetables to include women, and that day, the concept of the Women's Health Office, the Office of Women's Health, was born. I tell you that story because I'm so proud of that. And Dr. Pinn, we couldn't have done that without Dr. Healy and yourself. But we came up with the right organization and so on. And we had the incredible help over the years before Bernadine, you and I could do that, of Dr. Ruth Kirstein, who had pioneered in so many ways. But I was so proud of what we were able to do. And out of that came the famous hormone study that has changed the effect of clinical practice. Right before Dr. Healy passed away, I called her. And we had a wonderful chat about so many things we had done together. And I said, Bernadine, did you see the Times the other day? It said, I get pretty choked up because it was the last conversation I had with her. I said, the Times reports that hormone study, the results of it, have lowered breast cancer rates in this country by 12%. And her last words to me, wasn't that great? We've saved lives 1 million at a time. Wow. So we can talk about the past, but the past is the past, and we need to look at the future. So though I'd like to talk about savoring the past, I want to talk about fighting for the future. And I want you to know that in this year's appropriations, like I said that day with Felicia Sanchez, I'm going to work my earrings off that the last appropriations for the NIH under Barbara Mikulski's watch is going to be the best damn appropriations you've ever seen. And I'm going to make sure, I'm not going to go through it institute by institute, office by office, center by center, but my first one is do no harm. What do I mean by that? No sequester, no shutdown, no slam down. Let's get our job done. You do your job, we need to do our job. If we can be half as good as you, we will find a cure for the political toxicity that is facing our country right now. Then my next approach is capitalize existing programs. You're all doing great work. We need to make sure that what you're doing gets funded. You need something that's reliable, undeniable, sustainable. Don't screw around, keep it going, and that's exactly what we're going to do. But we're also going to see if we can find new money for our new ideas and some of the ideas that are already on the books. The Brain Initiative, precision medicine. Let's not forget our young investigators, all of those things. But let's look at where we can find bonus money called mandatory funding to make sure you even get a bigger shot at the moonshot or all the other great things that you're working on. So we're going to keep at it. So we hope to be able to continue to help you be you. But along the way, we need to stand up for the future. We need to make sure that our young people can begin to follow the American dream of being able to follow their passion. And if they want to find cures, if they want to develop their life to life science, if they want to devote their life to healing, that the United States of America uses its great resources and its great wealth to be able to support them. We want to be able to do that. But in order to do that, we need to make sure that we have education. I do believe with Condoleezza Rice that education is one of the great civil rights issues of this generation. We need to make sure that your health isn't determined by your zip code and your education isn't determined by your zip code. We've got to look out for K through 12. And when I go around to the schools in Maryland and talk to my colleagues, it's in the middle school that we hear where children are going. I know of a little boy right now in Massachusetts who is working on a biology, because I know the family up there, and there's one right here I know in Maryland, because he joined like a biology club when he's 10 years old. He wants to do cancer research. He's already thinking about it. Already thinking about it. There's a little girl in a school, whether it's in Baltimore or in Bethesda, who's thinking about the same thing. We need to make sure we are supporting education and supporting after-school activities so that our kids don't, if they get the bug, it's the learning bug that they get. And then we need to make sure that college is affordable and accessible. And not only college, but graduate school. Each and every one of you in this room, particularly as I look out at the younger people here. We know you were in debt from undergraduate school, then you layered on debt from graduate school, and then you face an uncertain future about your research grants. You can't create excitement that way. And I believe what we need to do is make sure that both graduate and undergraduate education is. I believe in the school of thought. There will be those who want to make school free. If we can afford to do it, I'm all for it. But in the meantime, you know, there are those who want to put term limits on politicians, something to debate. But I also believe there should be term limits on student debt, and that should be undebatable. How about your student debt where you pay a certain percentage of your income, and at the end of 20 years, no matter what you paid, forget the debt, get on with your life, get on in building America. You shouldn't carry that debt. The benefits of an education on you accrues not only to you, but it accrues to all of us. What do you think about that? So these are the kind of things that I'm working on now, but I will continue to work on, because I do believe in the future. And I do believe we need to stand up for the future. When I came to the United States Congress, I had a rotary phone and I had a typewriter. Carbon was something, you had carbon paper, okay? You didn't have the carbon in the atmosphere. Look at how the world has changed. Who would have known the dawn of the internet? Who would have known the dawn of the genome? Who would have known the dawn of all those other things? We want continuous dawns. We don't want twilights of our future and our future opportunity to be able to do this. So no matter where I go, no matter what I do, I'm going to continue to be your advocate, all the way up to my last hours in the United States Senate, and then after that, I'll find a way to have something to say. You can count on that. I'll find a way to have something to say. But I wanted to conclude by saying this. I will never forget you. I will never, ever forget you. Helen Keller, though blind, had probably one of the visionaries of her time. And she said, all that you deeply love, you never lose. All that I come in contact with becomes a part of me. So when I think about my visits here, into Hopkins, into Maryland, into other places doing great research, I think about all that I've met. I think about Felicia Sanchez and all the patients that I've met here, and remember their resiliency, their determination, but their belief that this was the National Institutes of Hope. I remember the directors who offered not only organizational leadership, but inspirational leadership, that we could do it. We could find more. We need to find more resources so we can find more cures and breakthroughs. And we thank them for what they did. They came up with new science and new ideas, and some, like Dr. Ruth Kirstein, had to fight old bigotries and stereotypes, and there are others in this room who face this as well. And then I think about the support staff, the reliable security people who keep you going, the gifted facility managers who, despite old wiring and old pipes, keep these facilities going. Because here at NIH, everybody wants to make a difference, and everybody working together wants to make change. How could I ever forget that? And I want you to know, all of you whom I have met, you've become a part of me. You will always stay with me. And I want to conclude by saying, God bless you, and may the force be with us. Probably a plaque.
Senator Mikulski earlier today said she had so many plaques that she needed a repository, which made me slightly uneasy about what I'm about to do.
I thought he was going to give me like a liver in a plastic or something.
We can arrange that, but no, at the hearing last week, I don't know if you remember, we commented on the fact that you were coming out here and that we wanted to celebrate you, and you said, oh, well, maybe you'll give me a plaque with a gold-plated Petri dish on it.
Oh, boy. I've never had one quite like this.
Good.
This is great.
And let me read the citation. So this says, for her extraordinary vision, boundless enthusiasm, and tireless efforts on behalf of biomedical research during her 40 years in Congress, her work has been vital to ensuring that the National Institutes of Health remains the National Institutes of Hope for all humankind. Presented to Senator Barbara Mikulski. Congratulations for all you've done for us, and many thanks.
Thank you.
And of course, I'm not quite done. Because you also have told us this wonderful way of describing how you have been working for NIH, and you gave me a new term about that. You're going to raise hell for NIH instead of raising money for a campaign. Well, just keep up that raising hell. But the other thing you've talked about and spoke about when you met with the patient we just talked about was working your earrings off. So we kind of worry that maybe sometimes you lose them and you might need occasional a backup set. So here we have a very special backup set.
Oh, my. Diamonds might be a girl's best friend, but NIH earrings are better than...
So they do have the same logo on them that many of us are wearing on our lapel, but no one else has earrings. Everybody else has to find a piece of clothing to put them on. So you're the only holder of this very special jewelry, and let me be clear that the government funds were not spent on this.
Oh, that's okay. Thank you, everybody. God bless.
Thank you.